On the vaccines issue, there was, I think, a comment last week from some couple of scientists who said the testing ground for the new vaccines will be Africa. To be honest, I was so appalled, and it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen. And it was a disgrace, actually, and appalling to hear during the 21st century from scientists that kind of remark. And we condemn this with the strongest terms possible. But we assure you that this will not happen in Africa and will not happen elsewhere. On the vaccines issue, there was, I think, a comment last week from some couple of scientists who said the testing ground for the new vaccines will be Africa. To be honest, I was so appalled, and it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen. And it was a disgrace, actually, and appalling to hear during the 21st century from scientists that kind of remark. And we condemn this with the strongest terms possible. But we assure you that this will not happen in Africa and will not happen elsewhere. I know that I am just an individual. Tedros is a dot in the whole universe. Issues targeted at me personally, I don't mind. I prefer to really focus on saving lives. I said it many times. We're losing people. Why would I care about being attacked when people are dying? Compare the two. We're losing lives every minute. Please remember, more than 60,000 deaths. I'm not sure if that number is accurate. I would expect that we have estimate that we have more deaths. Why would anyone in the right conscience think about his personal attack, ignoring the bigger challenge we're facing as humanity? My focus is saving lives. We don't do politics in WHO. We don't. We care for the poor. We care for those who are vulnerable. And we regret when we lose lives. That's where we should focus. I'm an individual. I'm no better than anyone who is suffering from COVID. I don't care who says what about me. I would prefer to focus on saving lives. No time to waste. How many more deaths would I like to see? I can't. Why would I worry about myself when the number of deaths is increasing? Who am I to make my personality before the deaths of all around the world? That's why I said, maybe you have followed my Twitter messages, humility. And compassion. And care. And big heart for those who are suffering and for the families who have lost their loved ones. I can tell you personal attacks that has been going on for more than 2-3 months. Abuses, or racist comments, giving me names, black or Negro. I'm proud of being black or proud of being Negro, because that Negro is black, black is black, and I'm proud. I don't care, to be honest. And thank you for asking that question. Maybe for the first time I would make this public. Even death threat, I don't give a damn, because it's personally targeted to me. 3 months in the same situation. What makes me sad is, I said it last presser, when the whole black community was insulted, when Africa was insulted, then I don't tolerate. Then I say people are crossing the line. When it's personal, even death threats, I didn't care. I didn't even respond. When, as community, people start to insult us, that's enough. That's enough. We cannot tolerate that. But since I don't have any inferiority complex when I am personally affected or attacked by racial slurs, I don't care, because I am a very proud black person or Negro. I don't care being called even Negro. I am. That's what came from some quarters. And if you want me to be specific, 3 months ago, this attack came from Taiwan. We need to be honest. I will be straight today. From Taiwan. And Taiwan, the foreign ministry or so, they know the campaign. They didn't dissociate themselves. They even started criticizing me in the middle of all that insult and slur. But I didn't care. 3 months. I say it today because it's enough. But still, they can continue. I don't care. Because what I care is when humanity is insulted, when we don't care, when we have more than 60,000 body bags. I care when the crosses are lined and when black community is insulted as community. So it's not personal. I tolerated 3 months and I can tolerate 3 years, 30 years, 300 years. No problem if it's personal, if it's targeted to Tedros. But I assure you, we will do everything right in WHO. We will do everything that we can to serve humanity. We will do everything that will help us to have no regrets at all. But in that process, we may make mistakes. We're not angels. We are human beings. So we make mistakes like other human beings. That's why I said we will do assessment, we will see our weaknesses, we will see our strengths. Let's care about each and every individual, the human being. And I will repeat again, we need national unity. Unity across party lines. Let's not use this COVID to attack party or another opponent. We need global solidarity. The most powerful should lead the way. And please quarantine COVID politics. That's what we want. We don't care about personal attack. We don't. We care about the life passing every single minute unnecessarily because we couldn't unite to fight this virus and because we're not understanding the power of unity to fight a common enemy. There is a very clear line, a fight between humanity and this virus. That's it. That's what we should use to fight and win. Thank you.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died. Had other nations likewise suspended travel from China, countless more lives would have been saved. Instead, look at the rest of the world, look at parts of Europe. Other nations and regions who followed WHO guidelines and kept their borders open to China accelerated the pandemic all around the world. Many countries said, we're going to listen to the WHO, and they have problems the likes of which they cannot believe. Nobody can believe. The decision of other major countries to keep travel open was one of the great tragedies and missed opportunities from the early days. The WHO's attack on travel restrictions put political correctness above life-saving measures. Travel bans work for the same reason that quarantines work. Pandemics depend on human-to-human transmission. Border control is fundamental to virus control. Since its establishment in 1948, the American people have generously supported the World Health Organization to provide better health outcomes for the world and, most importantly, to help prevent global health crises. With the outbreak of the COVID-19 pandemic, we have deep concerns whether America's generosity has been put to the best use possible. The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion. The world depends on the WHO to work with countries to ensure that accurate information about international health threats is shared in a timely manner. And if it's not, to independently tell the world the truth about what is happening. The WHO failed in this basic duty and must be held accountable. It's time, after all of these decades. The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts. There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate and investigate immediately. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening, despite reports and clear evidence to the contrary. The delays the WHO experienced in declaring a public health emergency cost valuable time, tremendous amounts of time. More time was lost in the delay it took to get a team of international experts in to examine the outbreak, which we wanted to do, which they should have done. The inability of the WHO to obtain virus samples to this date has deprived the scientific community of essential data. New data that emerges across the world on a daily basis points to the unreliability of the initial reports, and the world received all sorts of false information about transmission and mortality. The silence of the WHO on the disappearance of scientific researchers and doctors, and on new restrictions on the sharing of research into the origins of COVID-19 in the country of origin, is deeply concerning, especially when we put up by far the largest amount of money. Not even close. Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death, and certainly very little death by comparison. This would have saved thousands of lives and avoided worldwide economic damage. Instead, the WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China for its so-called transparency. I don't think so. The WHO pushed China's misinformation about the virus, saying it was not communicable and there was no need for travel bans. They told us when we put on our travel ban, a very strong travel ban, there was no need to do it, don't do it. They actually fought us. The WHO's reliance on China's disclosures likely caused a 20-fold increase in cases worldwide, and it may be much more than that. The WHO has not addressed a single one of these concerns, nor provided a serious explanation that acknowledges its own mistakes, of which there were many. America and the world have chosen to rely on the WHO for accurate, timely, and independent information to make important public health recommendations and decisions. If we cannot trust that, this is what we will receive from the WHO. Our country will be forced to find other ways to work with other nations to achieve public health goals. We'll have no choice but to do that. Our countries are now experiencing, you look all over the world, tremendous death and economic devastation because those tasked with protecting us by being truthful and transparent failed to do so. It would have been so easy to be truthful. And so much death has been caused by their mistakes. We will continue to engage with the WHO to see if it can make meaningful reforms. For the time being, we will redirect global health and directly work with others. All of the aid that we send will be discussed at very, very powerful letters and with very powerful and influential groups and smart groups, medically, politically, and every other way. And we'll be discussing it with other countries and global health partners, what we do with all of that money that goes to WHO. And maybe WHO will reform, and maybe they won't. but we'll be able to.
Thank you, Mr. President. Back to the WHO. Will you support the organization again if Tedros is immediately replaced, or do you want to see him step down as possible?
Well, we're doing an investigation. I don't know the gentleman, but I know there have been problems, and it's been very unfair to the United States, just like the World Trade Organization has been very, very unfair, and now they're coming into line. When they consider China a developing nation, and because China's a developing nation, they take massive advantage of the United States. Why didn't other presidents stop this? I've been talking about it from the day I got in, and we're looking at that very, very strongly. World Trade, So I have a problem with World Health and World Trade, both of them. I'm not sure which is worse, you want to know the truth, but we'll figure it out, okay?
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people. WHO is not only fighting COVID-19, we're also working to address polio, measles, malaria, Ebola, HIV, tuberculosis, malnutrition, cancer, diabetes, mental health, and many other diseases and conditions. We also work with countries to strengthen health systems and improve access to life-saving health services. WHO is reviewing the impact of our work of any withdrawal of US funding, and will work with our partners to fill any financial gaps we face and to ensure our work continues uninterrupted. Our commitment to public health, science, and to serving all the people of the world without fear or favor remains absolute. Our mission and mandate are to work with all nations equally, without regard to size of their populations or economies. COVID-19 does not discriminate between rich nations and poor, large nations and small. It does not discriminate between nationalities, ethnicities, or ideologies. Neither do we. This is a time for all of us to be united in our common struggle against a common threat, a dangerous enemy. When we're divided, the virus exploits the cracks between us. We're committed to serving the world's people and to accountability for the resources with which we're entrusted. In due course, WHO's performance in tackling this pandemic will be reviewed by WHO's member states and the independent bodies that are in place to ensure transparency and accountability. For that matter, involving all responders. This is part of the usual process put in place by our member states. No doubt, areas for improvement will be identified, and there will be lessons for all of us to learn. But for now, our focus, my focus, is on stopping this virus and saving lives.